Now, advice for parents, doctors and midwives to help prevent stillbirths has been published for the first time by NHS England.
At the moment, more than 3,000 babies in England are stillborn every year. Medics want to halve that rate by 2030. Well, we're joined now by Dr. Alex Heazell from Tommy's Stillbirth Research Centre at St Mary's Hospital at the University of Manchester. Good morning.
Good morning.
Good morning. So, OK, this number wants to be halved. No one would dispute that that would be fantastic if it could happen. So what is this bundle that's been put together?
So this is a package that's been put together by clinicians, researchers and parents that covers 4 main areas to try and support healthcare providers, maternity care providers, to reduce stillbirths. So
is this new advice, or is it just the advice that we're aware of or that mothers-to-be are aware of, but put together?
It's kind of a mixture of both, but mainly it's putting together the best practice, putting together what we know to make sure that we deliver the best care for mums and babies.
And put simply, the interventions that you're talking about, it's like a sort of leaflet type thing, is it, that affects, that's presented to people? How does it work?
There's, as I said, there are 4 components. The first is helping mums stop smoking. So every mum who comes will breathe into a carbon monoxide detector, and that will tell us about the level of smoking. The second is to look better for babies that aren't growing normally in the womb. The third is to give mums and care providers information about what to do when baby's not moving. And the fourth is to monitor babies during labour.
And are those things not happening already at the moment, or is this just pulling it all together?
So some of those things happen a lot. So obviously most babies are monitored in labour and they should be monitored appropriately. Other practices, so giving mums information about reduced movements and making sure that all babies are growing normally in the womb, are more varied. And the recent report from the National Perinatal Epidemiology Unit showed actually that in some cases of stillbirth, those things aren't being done. This is really to try and facilitate that and try and make sure.
I wonder how maternity staff are going to react to this information, which they already know. They know this stuff should be happening. If there isn't enough staff, and also mums-to-be, if they're saying, well, actually, I haven't seen the same midwife across the period of my pregnancy, or there aren't enough staff, surely that's the issue.
I think that is certainly one of the issues. I think, firstly, making sure that we're giving the best quality care, making sure the evidence that we have is put into practice is one thing, but also I think that we do need to work towards having maternity services that are woman-centred, and part of that is about trying to maintain continuity of care between professionals.
OK, Dr. Alex Heazell, thank you very much for joining us.